Hello and welcome. Today, we're diving deep into a fascinating and often misunderstood condition, sarcoidosis, with a special focus on its impact on the upper airway. The exact cause of sarcoidosis remains a mystery, making it challenging to pinpoint. What we do know is that it's an inflammatory disease, believed to be triggered by a combination of genetic predisposition and environmental factors. Some researchers suspect infectious agents, like bacteria or viruses, or even exposure to certain chemicals or dust, might play a role in susceptible individuals. However, no single trigger has been definitively identified. At its core, sarcoidosis is characterized by the formation of granulomas. These are clumps of inflammatory cells in various organs throughout the body. When sarcoidosis affects the lungs and upper airway, these granulomas can infiltrate the tissues of the larynx, trachea, and even the nasal passages. This infiltration can lead to swelling, narrowing of the airways, and disruption of normal tissue function, ultimately impacting breathing and voice production. Sarcoidosis isn't particularly common, but it does affect people worldwide. It's most frequently diagnosed in adults between the ages of 20 and 40, and it appears to be slightly more prevalent in women than men. Certain ethnic groups, such as African Americans and Scandinavians, have a higher incidence of the disease. However, sarcoidosis can occur in individuals of any age, race, or background. The signs and symptoms of sarcoidosis involving the upper airway can vary greatly depending on the extent and location of the granulomas. Common symptoms include persistent cough, shortness of breath, hoarseness or changes in voice, difficulty swallowing, nasal congestion, and even nosebleeds. In some cases, individuals may experience stridor, a high-pitched whistling sound during breathing, which indicates significant airway narrowing. General symptoms like fatigue, fever, weight loss, and swollen lymph nodes may also be present. Diagnosing sarcoidosis requires a thorough evaluation, as its symptoms can mimic other conditions. A physical examination, including examination of the upper airway using laryngoscopy or bronchoscopy, is crucial. Imaging tests, such as chest X-rays and CT scans, help visualize the lungs and airways. A biopsy of affected tissue, usually obtained through bronchoscopy or surgical removal, is often necessary to confirm the diagnosis by identifying the characteristic granulomas. Additional tests, like pulmonary function tests and blood tests, can assess lung function and identify markers of inflammation. Sarcoidosis isn't typically classified into distinct types based solely on upper airway involvement. Instead, the focus is on the overall stage of the disease and the extent of organ involvement. The staging system, usually based on chest X-ray findings, helps determine the severity and guide treatment decisions. The treatment of sarcoidosis involving the upper airway aims to reduce inflammation and manage symptoms. Corticosteroids, such as prednisone, are the mainstay of treatment and are effective in suppressing the immune response and shrinking granulomas. Other immunosuppressant medications, like methotrexate or azathioprine, may be used in cases where corticosteroids are ineffective or poorly tolerated. In some instances, surgery or laser therapy may be necessary to remove granulomas that are causing significant airway obstruction. Supportive care, such as oxygen therapy and pulmonary rehabilitation, can help improve breathing and quality of life. Unfortunately, there's no known way to completely prevent sarcoidosis. Because the exact cause is unknown, it's difficult to develop targeted prevention strategies. However, avoiding known triggers, such as exposure to certain environmental toxins or irritants, may help reduce the risk in susceptible individuals. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, can also support overall immune function. The prognosis for sarcoidosis involving the upper airway varies depending on the severity of the disease and the response to treatment. In many cases, the condition resolves spontaneously or with treatment, and individuals can lead normal lives. However, in some cases, sarcoidosis can be chronic and progressive, leading to permanent lung damage or airway obstruction. Recent research is focused on identifying genetic risk factors, developing more targeted therapies, and improving diagnostic techniques. Scientists are also exploring the role of biomarkers in predicting disease progression and treatment response. With ongoing research and advancements in medical care, the outlook for individuals with sarcoidosis continues to improve.